Imagine a new mother, full of promise. And then suddenly she's facing a really serious health crisis. It's a tough picture, right? And today we're not talking about human mothers, but we're diving into something called metritis. It affects new moms in the animal world, specifically dogs and cats.
That's right. It's this postpartum uterine infection.
Yeah, and it's maybe more complex than people might think.
Definitely. And while, metritis isn't exactly a household name, it's a really critical thing for pet owners to be aware of, for anyone involved in animal welfare, actually. So in this deep dive, we're going to sort of unpack what it is, how it happens, the signs to look for, and the different ways it's treated.
Right. The goal is to give you a clear understanding. Yeah.
Exactly. Equip you with the essentials.
So you can recognize this infection in, your dog or cat, grasp what it means, but without getting totally bogged down in medical jargon. And we've looked at expert veterinary sources for this.
Pulled together the key insights.
Okay, so let's kick off with the basics. What is metritis exactly?
Well, at its core, metritis is a bacterial infection. It happens in the uterus right after giving birth, usually within that first week.
The first week, okay.
Yeah. Though it can pop up less often after, say, abortion or maybe non-sterile artificial insemination. It's pretty rare after just natural breeding, though.
Interesting. So how does the infection actually, get started in there?
Typically, bacteria make their way up through the cervix. The cervix is naturally a bit more open around the time of birth, you see.
Right, that makes sense.
And then they get into the uterus. Now, a uterus that's just had puppies or kittens is, well, it's larger, more relaxed.
Yeah.
It basically becomes this ideal environment for bacteria. Warm, moist, lots of nutrients.
A breeding ground, basically.
Exactly.
Are there specific types of bacteria we should be thinking about? Or is it just anything?
We often see gram-negative bacteria involved.
Yeah.
And one of the most common culprits is Escherichia coli.
E. coli, okay.
Yeah.
People know that name.
Yeah, it's a frequent offender here.
Yeah.
Which really highlights why good hygiene around the birth is important, although sometimes it can happen even with the best care.
It sounds like this isn't just a minor local infection then. How bad can it get?
Oh, it can get very serious, potentially life-threatening, actually.
Wow.
If it's not caught and treated quickly, the infection can spread from the uterus out into the bloodstream. That can lead to septic shock, which affects all the organs.
So it starts in the uterus, but it can go systemic really fast.
Precisely. That's why recognizing it early is so critical.
And what about long term? If the animal recovers, are there any lasting problems?
Unfortunately, yes, there can be. Sometimes metritis can become chronic, sort of lingering.
Okay.
And it can also cause infertility down the line. It can damage the uterine lining, making it hard or impossible to carry another pregnancy.
That's a big deal, especially for breeders, but even for pet owners.
Absolutely. It affects future possibilities.
Okay, so clearly catching it early is vital. Who's most at risk? Are we talking specific breeds or ages?
Well, it mainly affects female dogs, bitches, and female cats, queens, right after they've given birth, that postpartum period.
You're right.
But interestingly, the research we have doesn't really point to any specific breed or age being more prone to it than others.
So no particular dog or cat gets a free pass then?
Nope. It's a potential risk for any new mother dog or cat, so everyone needs to be watchful.
That's really important to know. Okay, so what are the key things someone at home should be looking out for, those telltale signs?
One of the biggest clues is often a really foul-smelling discharge from the vulva.
Foul smelling, okay. What does it look like?
It can vary. It might look like pus, so we'd call that purulent.
Yeah.
Or it could be mixed with the blood sanguine of purulent. Sometimes it can even be sort of dark green.
Dark green?
Yeah. And beyond the discharge, just the mother's general behavior. She might seem depressed, lethargic, just not her usual self.
Right, a definite change in demeanor.
What else? Loss of appetite is common anorexia. Or maybe she starts neglecting her puppies or kittens, not nursing them properly or cleaning them.
Okay, not being maternal.
Exactly. And reduced milk production is another big one. And here's something slightly less obvious, perhaps. Sometimes they drink and urinate a lot more.
Really? Why is that?
It's because the toxins produced by the bacteria endotoxins can affect how the kidneys work, how they handle water. So you get this increased thirst and urination, polyuria, and polydipsia.
Wow, okay. Those are all things an owner might notice. What about when they get to the vet? What might you find on a physical exam?
Well, a fever is pretty common. When we palpate the abdomen, feel the belly, the uterus itself might feel noticeably large. Signs of dehydration are possible too. And if you look at their gums, the mucous membranes, they might look really red, sort of injected.
Injected, okay.
And if things are progressing towards sepsis, that systemic infection, we might hear a really fast heartbeat, tachycardia. The
Yeah.
body's trying to compensate.
So it's putting together the owner's observations and the vet's findings. Now let's dig into the causes a bit more. What things actually increase the risk of this happening?
Several factors really stand out. Dystocia that's a difficult or unusually long labor is a major risk factor.
Okay.
Also, any kind of obstetric manipulation, like if assistance was needed during the birth, that can introduce bacteria.
Right.
And then there's the issue of retained materials, like if a fetus or a piece of placenta gets left behind inside the uterus, that provides essentially dead tissue for bacteria to feed on.
Makes sense.
Yeah. And even just a very prolonged delivery, especially if it was a large litter, can increase the risk. And like we mentioned, though less common, it can happen after an abortion or sometimes after insemination, but really quite rarely after a normal natural breeding in a healthy animal.
It seems like anything that disrupts that normal postpartum process or leaves something behind can set the stage. Okay, so if you suspect metritis based on the signs and history, how do you confirm it? You mentioned other things could look similar.
Exactly. We need to differentiate it. For example, there's something called subinvolution of placental sites, basically. The areas where the placenta is attached don't shrink back down normally, causing bleeding. That's different from infection.
All right.
Then there's eclampsia, or milk fever. That can cause the mother to act sick, but it's due to low calcium, which we can check with blood work.
Right.
And mastitis, that's an infection in the mammary glands, the breasts. You'd usually find swelling or pain there,
Yeah.
not primarily in the uterus.
So lab tests are crucial then. What would you expect to see in blood work, for instance?
A CBC, a complete blood count, is usually very informative. We often see a high white blood cell count, particularly neutrophils, the infection fighters. And often we see more immature neutrophils being released. That's called a left shift, and it signals a strong response to infection. Although sometimes, in really severe, overwhelming cases, the white count might actually drop, which is a bad sign. We might also see signs of dehydration, like a higher concentration of red blood cells and protein. Kidney values might be affected too. Sometimes there's mild anemia or elevated liver enzymes because of those circulating bacterial toxins.
So the blood tells a story.
It does. And a urinalysis can help too, looking at kidney function and checking for bacteria in the urine.
What about imaging? X-rays, ultrasound?
Both can be useful. X-rays might show an enlarged uterus, maybe even a retained fetus if it's calcified enough.
Okay.
But ultrasound is often even more helpful. It gives us a really good look inside the uterus. We can see fluid accumulation, check the thickness of the uterine walls, and spot retained placentas or fetuses much more clearly.
That sounds very definitive.
It can be. And in a worst-case scenario like a uterine rupture, ultrasound might show fluid accumulating in the abdomen itself.
Are there other specific diagnostic steps, maybe looking at the discharge itself?
Yes, vaginal cytology. That means taking a sample from the vagina and looking at the cells under a microscope. With metritis, we typically see lots of neutrophils, often degenerating ones, mixed with bacteria.
Okay.
And ideally, we'd also try to get a guarded culture from inside the uterus or the anterior vagina. That helps us identify the specific bacteria, aerobic and anaerobic, and figure out which antibiotics they're sensitive to.
Guiding the treatment.
Exactly.
So once you have that diagnosis confirmed, what's the treatment plan? How do you approach it?
Often, the first step is hospitalization. We need to stabilize the animal, especially if they're showing systemic signs like dehydration or shock.
So supportive care first.
Right. Intravenous fluids are key, balanced electrolyte solutions. We correct dehydration, treat shock if it's present, and fix any electrolyte or blood sugar imbalances based on their blood work.
And then more direct treatment. Does surgery come into play?
Yes, frequently. An ovariohysterectomy, basically. Spaying, removing the uterus and ovaries, is often the treatment of choice.
When would that be the main recommendation?
Especially if there are retained fetuses or placentas, if the uterus is ruptured, or if the infection is just really severe and not responding to medication. It's also the way to go if the owner doesn't intend to breed the animal again.
Makes sense. Remove the source of the problem.
Precisely. Now, in some, maybe chronic cases where future breeding is desired and the uterus isn't, totally falling apart, you might consider a hysterotomy and lavage. That's surgically opening and flushing the uterus. But you have to be incredibly gentle if the uterine wall is fragile.
Right. High risk there potentially.
Definitely.
So surgery is a major option. What about medications? Antibiotics must be key, right?
Absolutely essential.
Right.
We start with broad-spectrum antibiotics right away, ones that cover a wide range of likely bacteria, or we wait for those culture results.
Oral or pee?
Depends on the patient. If they're stable, oral might be okay. But if they're sick, in shock, definitely intravenous to start. Once the culture and sensitivity results are back, we can switch to the most targeted antibiotic,
And how long is the treatment?
usually at least 2 weeks. And it's important to give the antibiotic separately from some other drugs we might use, like prostaglandins, because the combination can increase the risk of vomiting.
Are there specific antibiotics you often use?
If the mother is nursing, we lean towards things like amoxicillin, clavulanic acid, or maybe oxacillin. If she's not nursing, we have more options, like enrofloxacin, which is quite effective, but not usually recommended for nursing animals.
Okay. Any other medications besides antibiotics?
We might use oxytocin very early on, like in the first day or two after birth, to help the uterus contract and expel contents, but its effectiveness really drops off after about 48 hours.
So timing is critical for that one.
Yes. Another option is prostaglandin, PGF2 alpha. That also helps stimulate uterine contractions to evacuate fluid and debris. But with prostaglandins, you need to monitor closely with ultrasound to make sure the fluid is actually clearing out and there are no complications.
Are there times when you wouldn't use these? Contraindications?
Yeah, definitely. Prostaglandins carry a risk of rupturing the uterus if the tissue is already badly damaged or devitalized. So caution is needed.
Okay.
And as I said, oxytocin isn't very useful after those first couple of days.
Mhm.
Also, aggressively flushing the uterus, like lavage, is generally avoided if the uterine wall seems really weak or compromised.
Got it. So it's always a tailored approach. What about after treatment starts? What kind of monitoring is needed and what complications should owners be aware of?
Monitoring is really important. We'll keep track with repeat blood work, CBCs,
Yeah.
checking her temperature, looking at the vaginal discharge, and just assessing how she's doing clinically, her appetite, her energy levels.
Yeah, ultrasound.
Yes, especially if we're using medical management like prostaglandins. We'll use follow-up ultrasounds to see if that fluid in the uterus is decreasing as expected.
And potential bumps in the road. Complications.
Well, the main one is that medical treatment might fail, and then surgery, the ovariohysterectomy, becomes necessary anyway. There's also always that risk, especially with medical management, of the uterus rupturing, which leads to peritonitis, a really severe infection of the abdominal cavity.
That sounds serious.
It is. And of course, we have to think about the puppies or kittens. If the mother is very ill, or if milk production drops, they might need supplemental feeding, maybe even fostering or complete hand-raising.
And monitoring them closely too, I imagine.
Oh, absolutely. Watching their weight gain is critical. Puppies should gain about 10% of their birth weight each day, roughly. Kittens, we look for at least 7 to 10 grams per day.
That's good specific guidance. Okay, overall, what's the outlook? The prognosis for an animal with metritis.
You know, it's generally good if they have the ovariohysterectomy, especially if they're older or weren't going to be bred again anyway. Surgery is often curative.
And with medical treatment.
With medical treatment, the prognosis really hinges on how early it's caught. If the owner recognizes the signs quickly and gets veterinary help promptly, the outcome can be good. But there's always that potential impact on future fertility we talked about.
So it really comes back to that early recognition and quick action being absolutely crucial.
Couldn't agree more.
Okay, so wrapping up our deep dive today. Metritis is, it's clearly a serious bacterial infection in postpartum dogs and cats, but it does have recognizable signs, and there are effective treatments, ranging from medication right through to surgery. Spotting those early signs is just paramount for the mother's immediate health, for her babies, and potentially for her ability to reproduce later on.
Exactly. And, you know, thinking about that postpartum period, how delicate it is, it does make you consider what other, maybe less obvious challenges these new mothers might be facing.
That's a great point.
And it really underscores how just being observant, how paying close attention as an owner can make such a huge difference to their well-being and the survival of their young.